Coming up next is Dr. Kimberly Taylor. Here's your chance to talk about what matters to you. Although you will receive helpful advice from Dr. Taylor, remember, this is not to be construed as a form of psychotherapy, diagnosis, or treatment, and cannot replace a therapeutic relationship with a mental health professional. You can reach Dr. Taylor by calling 564-1290 or toll free at 866-564-1290. You can also listen live on the internet at drkimtaylorshow.com. So here now is Dr. Kimberly Taylor.
So here we are. We're into the first weeks of the new year, and it's a time that we often think about making changes and having a fresh start. It seems really that everyone is trying to do better, whether it's eating healthy, exercising, or dealing with emotional well-being. In general, people are trying to improve their lives in this new year. So with that in mind, I'm often asked about therapy and whether it would be a good idea to start. And there's lots of questions that come up. Questions about how does therapy work? What should I expect? How do I find a good therapist? How will I know if therapy is working? And here's one. How long will it take? Are typical questions that I'm asked. So I thought that it would be good to spend part of this time to just take a few moments to answer these questions. Because at some point in all of our lives, each of us may feel overwhelmed and we're going to need help dealing with whatever our problems are. You don't have to have a mental illness to benefit from therapy. We all have challenges. We all struggle, whether it's issues of self-esteem, navigating marriage, relationships, coping with stress, change, loss, death, disappointment, or just finding one's purpose and passion in life. What I'd like you to do is think about it this way. When you're driving your car and the wheels are out of alignment and it goes bump, bump, bump down the road or starts to steer off the road, you can actually feel it. And in fact, you think nothing of taking it into the shop and getting the tires rebalanced. It's just as simple as that. Well, going to therapy should be as simple as that too. Because when you feel your life is out of balance, you should take yourself into therapy in order to get your life back on track. I think one of the biggest misconceptions about therapy is that seeing a therapist is a sign of weakness. But the truth is, seeking professional help is really a sign of both strength and determination to live a productive, a meaningful, and a real balanced life. And believe me, we can all use the help. And here's one more truth. Therapy can be the best thing that you will ever do, and it may be the hardest thing that you will ever do. But the people who are really willing to look within themselves and to take that risk, to get professional help, to really look at what's working and what's not working in their lives, are some of the most courageous people of all. What we do know is that sometimes it is helpful to talk to family and friends and to go through with them about what's going on. But most of the time, they're going to tell you what they think you want to hear. Sometimes you just need an outside perspective. And this is someone who is not directly involved with what's going on. And that's when really talking to a therapist can help. In our lives, what we're doing is we're often recreating patterns with people or situations where we pick the same unhealthy people or the same unhealthy pattern time and time again, and then we end up hurt and confused as to why it didn't work out. Well, therapy is a chance to work out these patterns. It is a time to kind of sit back and finally understand what your fears are, what the obstacles are, so that you can challenge and confront what needs to change and stop repeating the same mistakes over and over. We all have some blind spots, but you need to figure out what yours are. So let's get into how do you find the right therapist? Well, to find the right person for you, it's going to take some time and work. But believe me, it's well worth the time that you put in, because the the bond that you have with this therapist is what is most essential. You need someone that you can trust, that you can feel free to speak your mind, and to tell the truth to. And this therapist should really make a contribution to your growth and not just be there to hold your hand and to be supportive. Also, what you need to know is that someone who works well with one person may not be a good choice for you. So you really need to shop around. And a good therapist should open you up and challenge your thoughts and beliefs, because therapy is a place where you are supposed to share your life experience and to look at whatever's going on, so that the therapist is not just there to challenge you, but they're there to be present to hear you. And what you need to know is that they are not there to judge you. They are there to help you deal with your pain so that you can grow and move forward in your life in a positive way. So how do you go about finding this person? Well, one way is to start by asking friends or ask family, because there are a lot of people out there who have gone to see people, and they will be able to tell you what works, what does not work. And you can also go to your doctor or go to a health professional. You can also look them up. You can Google their websites. You can look for a therapist who has experience treating the problems that you have. What I would also tell you is go ahead and check with the state board. Look at their current licensing and ask, are there any complaints against the therapist that you are thinking of going to? What you want to do is you want to do your homework here. And then set up a time to meet them, because you want to ask some questions of this therapist. And most therapists are willing to do this. What I believe is that it must be a good fit for both you and the therapist. So when you're in that first meeting, you might want to ask them about their level of training and how many years that they have been practicing. You also want to tell them what your problems are. And you want to ask them, do you have experience helping people with those problems? You also want to ask yourself, do you feel as if this therapist understands you? Is the therapist a good listener? And do they pick up on your feelings and what you are really saying so that you feel heard and understood? This is important. Also, during this time with them, that you should get a sense of how the therapist works and if you feel a connection with them. And then trust your gut. Are you comfortable with this person? Are you comfortable in the office? That's important too. You are going to be sitting there for a while, so you want to be comfortable. Choose a therapist with whom you feel comfortable, but that you know you will be challenged. Because if you're not challenged, you're not going to grow. Also, during that time, you can ask about their fees, the payment plans, and any kind of insurance options. So what people ask me a lot is, what should they expect in therapy? Well, first and foremost, therapy should be a safe place. While you will be uncomfortable at times because you are going to be challenged and you are going to be facing some uncomfortable feelings that come up, you should always feel safe. And it's really important that if you are starting to get overwhelmed, or if you're actually starting to dread coming to therapy, that you need to talk to the therapist about that, because there are things going on. What I want to make sure that you know is that you will not always leave the session feeling good. There are going to be times that painful memories or feelings are going to come up, and they're actually going to stay with you after the session. That's normal. That's okay. But let your therapist know, and they will help you and guide you through this process. Therapy is a partnership that both you and the therapist contribute to. So you are not expected to do all of the work all by yourself, but also your therapist cannot do it for you either. They're there to help. And a good therapist will help you to understand yourself so that you can gain some insight, so that you can make these better choices in your life and not just react emotionally to everything all the time. It is important to know what triggers you and why you respond the way you do to situations, to people, whatever it is. Therapy helps you to face yourself. It helps you to come to a better understanding about yourself and then how you relate to other people. One of the things you should talk about with a therapist is about the goals and what you hope to achieve in therapy. And let me tell you, this should be an ongoing conversation that you check in throughout the therapy to really review the progress and to help you to stay on track. So one of the other questions I get asked is, how will I know if therapy is working? Well, when therapy is working, you will know it. You may not always know the answers to your problems right away, but in the talking about the problems, of being challenged, that all really starts to move you forward. You and your therapist are really partners in this process, so that the therapist is going to guide you, and they're going to make all kinds of insights. They're going to say, well, maybe you could do this instead, but only you can make the changes that you need to move forward. And as the therapy does progress, you will actually use the relationship with the therapist as an opportunity to reshape significant issues and to work through problems that you've had with other people in your life. And again, it's in this process of really trusting that you are able to finally let out and release your feelings, both the good, the bad, and the ugly, and then be able to move forward. So your therapist, again, will help you, but you must ultimately do the work to create the changes that you want. You actually have some real heavy lifting to do here. It's not like taking your car in and having it fixed while you go out for lunch. And then lastly, how long should therapy last? Well, here's one that's kind of hard to just pick one time. It really will depend on what the problems are. You may have a complicated issue or a relatively straightforward problem. But either way, again, talk with your therapist and keep talking about it throughout the work. The goal here is for you to leave therapy, to not get too comfortable and stay. This is not a paid friendship. It's not for you to become dependent on somebody else to tell you what the answers are. Therapy is all about helping you find your answers from within. So to use that old car story again, once in a while, when things get out of balance, you can go back in for a tune-up with therapy and then get back on the road of life. So let's open this up. Let's have you call in. Do you have questions about therapy, or do you just want to ask me a question? We are all here to learn from each other. And what I'd like you to know is that when you share what's bothering you, that other people can also learn. And you'll find that we all have much more in common than we have different. And that ultimately, it's all about helping each other. So I really encourage you to give me a call today. I am here every Thursday afternoon. I am going to be here between 2 and 3. So pick up the phone now, and you can reach me by calling 564-1290 or toll free at 866-564-1290. We are going to take a break here, but I will be right back to take your calls. I'm Kimberly Taylor, and you're listening to KZSB AM 1290.
You are listening to Dr. Kimberly Taylor. You can reach her by calling 564-1290 or toll free at 866-564-1290.
Okay, we are back, and prior to taking a call, I think Richard is telling me here that he has a question for me.
Yes, I'm just curious about the issue of confidentiality.
Mm-hmm.
I've heard a lot of controversy over this.
It's a really
I've heard a lot of
important issue.
issues.
Mm-hmm.
It's my private time. What kind of guarantees do I get from the therapist in regards to this whole issue of confidentiality?
Okay. Richard is the engineer here who does all of the buttons, and I think it's a great question, because I think that's one of the things that people fear is if I come in and I talk about my friends or family, or if I even talk about myself and tell you all of my secrets, where does that go and who knows about that? Well, first and foremost, what you need to know is that that's the whole reason why therapy works, is because it doesn't go anywhere. That this is something that you can really share your truth, because it is a time to share, to let it all out, to go through all of that, and that it is a therapist's job to make sure that you feel safe with that, and for you to know that they are not going to be disclosing this to anyone else unless you want them to. For instance, you might want your spouse to come in, and then you might share with the therapist that it is okay to talk with my spouse about these things. And so those are the times that you would have some sense of control over what is said and what is not said to someone else. Now, having said all of that, I think it's important to know that there are times that if something comes up, that what is going on in the work that you're doing will come out. And that is if you threaten to do harm to yourself, or if you threaten to do harm to someone else or someone else's property. It's at that time that it is the therapist's job to do whatever they need to do in order to make sure that you are safe and any person that you are threatening is safe. And so at that time, the therapist would reveal whatever it is that they need to in order to handle just that.
May I dovetail off of that?
Sure.
A priest that I would go to confession to reveal my quote-unquote sins. There's confidentiality there. He is bound by a vow he has taken.
Yes.
Is the therapist bound in the same way by
Yes.
the law? So, in other words, if I was to reveal to him that I had, I'm going to go an extreme, committed a crime, the therapist cannot report that.
Correct. If it's in the past tense, yes, we are bound by our ethical standards. And so yes, this is just if they know of that they need to prevent some kind of abuse from going on. Now, if you have abused a child and the child is still in danger and that child has suffered, then yes, you would reveal that in order to take care of that person who cannot take care of themselves and who is being hurt by your client. Okay.
And this kind of goes into my next question having to do with the different types of therapists. I mean, a priest can be a therapist, but when we're talking...
They can counsel, yes.
They can counsel, but they may not have the academics behind them with the letters behind their name. And there are so many different letters. There are all different kinds of therapists.
There are.
There is no one therapist that fits all.
Correct.
So what are the different types?
Well, there are a number of different types of therapists that you can go to. You can seek therapy through a psychiatrist who actually is a medical doctor where he receives his MD first and then he specializes in this field. You could go to see a psychologist which would either have a PhD or a PsyD, and they have gone to school to study psychology, and so they have more training than, let's say, a marriage and family therapist. But they can all study some of the same things. Some of them are just more extensive in some of the fields that they study. But you do have marriage and family therapists who has a master's degree, whereas the psychologist has a doctoral degree. And then you could also see a licensed clinical social worker, and they have a master's degree in social work with some more clinical training. What I would say about, does somebody need to be fully trained and or have all these degrees to be a good therapist? No. I think a therapist is more or less not born, but that it is the art of the work. And even people who have a 2-year degree, sometimes they can be a great therapist. And sometimes people who have all of the degrees in the world are not great therapists. So you really have to shop it. You really have to feel comfortable with the person that you're with. But you do want to know that they do have some training.
And the confidentiality is across the board. Unless I was to, as a friend, I would come to you. Let's say you weren't a therapist, and I'm telling you this in strictest confidence. Is that binding in that respect? And I know we're starting to get into a legal area, but
do you mean because I am a therapist? If a friend comes,
let's just say you weren't a therapist.
Oh, okay.
And I came to say, I just wanted to share something with you, but I want this in strictest confidence. I don't want this to be passed on.
So this is friend to friend?
I'm now asking, and I'm sort of asking you to take on, so to speak, the confidentiality.
No.
It doesn't apply.
No,
Okay.
no, because your friends are not bound by any kind of legal, ethical means. It's just whether they want to have a friendship in which there is trust.
And ties into my final question about some of the myths. I just need somebody to talk to. I don't want to go pay $50, $75, $100 an hour
Right.
just to have somebody to talk to?
Okay. But truth is that you can probably just talk to your friends and they will chat with you and they will, go and process it over and over again. But a friend is not a trained professional. And like I said, most times friends tell you what they know that you want to hear because they have some stake in maybe what the outcome might be, or they don't want you to be upset, or they don't know how to tell you what the real truth is because they don't want to hurt your feelings. Going to someone who's trained, who is objective, who has no emotional stake, helps you to really start to reveal yourself and to see yourself by somebody who can help reflect that back and help you see some of the blind spots that have been in your way so that you can start to see yourself more clearly and maybe how other people see you too.
What about some of the other myths that people go in, the preconceived ideas that aren't true about therapy and therapists?
Do you have some in mind, or are you just thinking some of the general ones?
Well, I guess it's, and maybe one of the things you just said about going into therapy and expecting them to sort of support you, not necessarily take your side, but not criticize you, not tear you down.
Right.
I've actually had that experience where that's what happened. They actually started to, criticize, certain aspects, and it's like, I didn't think this was what therapy was about.
Well,
And in
that's
encounter group, I can understand, but not
right,
therapy.
and that's why one of the things that I would say is that you need to feel safe with the person that you're with, that they can be very challenging, very direct, and that's a really good thing. But you also have to know that they're not doing it for personal gain, or they're not doing it to hurt you. And oftentimes that is a fine line, because a lot of people who come in have been hurt by others, have been abused by others, and they don't know what's healthy and not healthy. So with the help of the therapist, you can work through that, so that some people are so highly sensitive that you can't even bat your eyelash at them without them thinking that you're thinking something bad about them. So it is a process of trying to work through that. But if you feel totally unsafe, then they've either gone too fast or it's just not the right therapist for you. Okay? All right, so it looks like we have a call, so why don't we go to the next call? Hi, this is Dr. Kim, and we're on the phone with Eileen. Hi, how can I help you?
Well, thank you, first of all, for taking my call. My question has to do with parents, actually one parent, who's getting very stubborn about giving up her driver's license, even though I feel that she's quite unsafe and probably shouldn't be driving, if not now, very soon. And my question is, how do I bring the subject around so it's sort of more her idea than mine, that maybe it's time to rethink her driver's license and driving?
Okay, has she gone to take the test?
She has gone several times and watched other people take it. Her birthday is coming up soon, and I think what I'm guessing she's doing is kind of trying to figure out if she can fake it, because her sight isn't as good as it used to be. But I think she's discovered they changed the eye charts. So anyway, I know she's been several times down there.
Okay, so
Just to check it out.
Okay, so she is trying very hard to pass this, but what you're seeing is that she also is struggling, that a part of her does know that she isn't the same, that her eyesight is not the same, probably her driving skills are not the same. What if you were to just let her go and take this test? Because the DMV is probably very well aware that some people this age, they do have to watch them rather closely. They do have to be able to know whether they're still capable of driving. And perhaps just the natural consequence of going through that process, they may actually do the pulling of this license for her.
That would be lovely, but you haven't met my mother, and she is so charming. She could just charm your socks right off, and has done many occasions found herself out of tickets because she's been getting quite a few of those lately. And she plays the little old lady, oh, I didn't know, gosh, so well that she still has her license.
Okay.
So I hear what you're saying.
Have you sat down with her and told her that you know that she could probably pass the test, that she can charm the socks off of all of these people, but that you are concerned and that it is time for her to consider what it would be like to give up her license at this time?
I've just been so afraid of hurting her feelings.
Mm-hmm. Well, that's why I think that to sit down with her and to just share that and say first, I really don't want to hurt you, but that I am concerned, and I do think it's time that we have this conversation. And most likely, she will know that it is coming. This is not going to be.
Right. It would be better, to be honest.
Yeah, and it's not going to be a surprise to her that if she's getting these tickets, if she's just barely talking her way through it, if she's going to the DMV and trying to memorize the eye chart, the dear woman, she is needing some help.
I think so. Well, thank you. That's really helpful. Thank you.
Okay. Thanks for calling. I'm Kimberly Taylor, and you're listening to KZSB AM 1290.
You are listening to Dr. Kimberly Taylor. You can reach her by calling 564-1290 or toll free at 866-564-1290.
So we've been talking about therapy, and everyone has challenges in their life. But I want you to know, if you are hurting or if your life doesn't seem to be working out, then talking with a therapist really can help. And it will really help you to be able to move forward instead of staying stuck. So some of the reasons and some of the times that you should consider therapy might be if you're feeling overwhelmed, and really, despite your efforts, the problem is just not moving forward and it's not getting better. Or maybe the problems are starting to get in the way of your work, your relationships, and how you feel about yourself. Also, if you're really anxious or constantly stressed out, therapy would be a good next move for you. Also, if your actions are harmful to yourself or to others, for instance, if you're drinking too much, if you're abusing drugs, or if you're becoming withdrawn and unmotivated in your life, then talking therapy can help you work out how to deal with all of these negative thoughts and feelings and to make a positive change. And you really want to do it with someone that you can trust, who has the experience to help you. I do want to remind you that this program will be rebroadcast Thursday evenings at 10 and Sundays at noon. And you can also listen live on the internet by going to my website at drkimtaylorshow.com. And I want to say that if you couldn't call in during this hour, then there is a chance to reach me Sundays, where I will be taking phone calls. And you can check out my website at drkimtaylorshow.com to find out the times and the contact number. So let's go to the next call. Hi, Lynn. This is Dr. Taylor. How can I help you?
Hi, Dr. Taylor. I'm calling because recently I've found myself thinking far too much in sort of fearful ways about loss. And I have experienced loss of family members and friends and loved ones, of course, like anyone, nothing extraordinarily unusual. But it seems to be the older I get, the more, obviously I lose. And I'm turning from a very positive to sort of a pessimistic person because I keep thinking and sort of becoming a little bit fearful. And I don't want to become, afraid to live because I'm afraid of losing more loved ones. Okay. So I'm wondering if there's any kind of tool you can suggest that would kind of keep that in line.
Okay. How old are you, Lynn?
55.
Okay. And is there someone that you are thinking about as you're talking? Is there someone that you're afraid of right now that you're going to lose?
Well, of course I would be afraid of losing my husband. But we both have aging parents, and we're watching them go through health issues and so forth. And that would also be my fear. And I have a sibling who's had some health issues, is doing fine now, but now I find myself thinking consistently about losing him.
Mm-hmm. Okay. And what do you do in your own life?
I'm pretty active. I've been a student, gone back to school, and been a student recently. So
Studying what?
around a lot of general courses and a lot of environmental studies.
Okay. And what do you hope to do with those?
I'm hoping to find out something I can do with those, a change, some kind of change.
Okay. And how long have you been going to school?
A little over a year.
Okay. But it sounds like there's something that you're still wanting to do with your own life.
Possibly. I mean, I've worked most of my life, and I've worked hard and accomplished and satisfied with my accomplishments, but I haven't pursued something that I feel passionate about. I just...
Okay. And if you could, what might that be? Mm-hmm. Right
Good
there.
question.
Yeah.
Good question. I would love to. If I was 20 years old, I'd love to get into some kind of environmental study. But at this stage, I don't know that I have what it takes to go the whole educational process and get into something that would really matter to me to make a difference.
Okay, Lynn, but there is a part of you that is wanting more meaning, more purpose in your own life, and is perhaps missing out on something, so that the thought of coming to an end is becoming very frightening to you. You said you have a passion, or had a passion. If you were 20 years old, this is what you would be doing.
Right.
I think that if you bring that passion back into your life and start doing things that bring more meaning to you, that make you feel more fulfilled on that level, that you may be less concerned about you said negativity or the thought of losing. Maybe maybe you're losing out. Maybe there's more that you need to be doing.
I think that's an interesting thought, because once I started back at school, and I haven't been in school during the summer, I noticed when I was in school, of course, my mind was active and busy and focused on something, and so I didn't really think about it as much.
Mm-hmm.
And so you have a point there. So now that I'm not focused on doing something that matters, I think more about it.
Yeah. And I think it's just a sign that, yes, you've done a lot in your life, but there's still more to come. And
I hope that's true.
And at 55, you're still young.
Yeah.
So maybe to focus more on what you can do to bring that meaning and to live that passion, so that you are using your life the way that you would like, so it doesn't feel wasted and it doesn't feel like you've lost out.
I think that makes a lot of sense.
Okay.
Well, thank you.
Okay, you have your work cut out for you.
Yes. I think what I'll do is just keep going and taking classes and hope that I can really connect with something in particular.
Okay. Just follow the passion, and the rest, you will be led the rest of the way.
Okay.
All right. Take care.
Thank you.
I'm Kimberly Taylor, and you're listening to KZSB AM 1290.
You are listening to Dr. Kimberly Taylor. You can reach her by calling 564-1290 or toll free at 866-564-1290.
Hi, Connie. How can I help you?
Hi, doctor. How are you?
I'm good. How are you?
I'm great.
What's going on?
Well, this has been an ongoing problem that's been going on for a long time, but it just recently happened this past Tuesday. And it has to do with my husband and my stepdaughter, his daughter. And they were meeting for lunch, and my husband waited a good half an hour, maybe a little longer. And like I said, this has been an ongoing problem with her always being late. And he just, was holding a table. It was a very crowded restaurant. And he finally, said he had had enough, waiting. And he just got up and left. And as he went out to the parking lot, she pulled in. And he just said, Allison, I've got to go. I've got other things to do. And he was, upset with her, and he left.
Okay.
And so he called me, and said, just told me, it's just so upsetting but it's an ongoing thing. So, but I'm wondering how you feel about how he handled it. And what do you do about someone that's part of a family that's always late? And
okay. And how old is Allison?
Allison is 44 years old.
So she's really not a child, correct?
Correct.
Okay.
Although sometimes I wonder.
Okay. So this is not like Dad can go back and do the consequences with her and teach her how to be a responsible child and to grow up to be a decent human being, correct?
Correct.
She's like formed. This is who she is. So actually the question needs to be, you can't really change someone else. I think it would be important for your husband and her dad for him to tell her the truth about what that feels like and how he does not like that and how he feels that she disrespects him. And he does need to let her know that part.
Well, he has. I mean, because like I said, she's 44 now, and this has been I've been married to him for 22 years, and I've known him for almost 30, and it's been a problem going way, way back. And he has told her, and they've gone sometimes where they don't talk for 6 months, and, because he does find it. He finds it, we happen to be people that are always on time, and we find it very disrespectful for people that do that. And for her, he definitely has told her. I mean, she knows how he feels, but it doesn't seem, I guess she's better for Allison. At times, she may only be 10 minutes late or 15 minutes late. She always, never to be on time. But I think it was last Thanksgiving, we were at the club and having, with a couple other people, and she was 45 minutes late. Well, the way we handle it is we just go on. We went ahead and just went, it was a buffet kind of a thing, so we went ahead and had our dinner and started.
Connie,
it's
but...
so annoying.
Yes.
I just thought...
Yes.
And so I don't know.
Connie.
I know it's...
Connie.
But I just think,
Connie.
do you think he did the right thing
Connie.
about...
Connie, slow down. You have built a lot of anger on this. This has been going on for a very long time. It is a long-standing thing, it sounds like, that goes on between Dad and his daughter. So this is really something that the two of them might need to work out, that they might need to sit down when it is not going on, when she is not late, but just at a quiet time when Dad can really sit down with her and say, is there any reason that you're doing this when you already know that it upsets me so much? And is there anything else that I need to know or that we need to talk about? Because if there is not, and this is just the way that you're going to treat me, then I'm going to choose to not make plans with you, and or if I do, I'm just going to continue on, whether or not you show up, but that you just need to know that it makes me want to be with you less and spend less time with you, not more. And just leave it for the two of them to try and work out.
That sounds very good advice. I like that.
Okay.
So I think I will tell my husband what you just told me.
Okay. Sounds good. Thanks for the call. I'm Kimberly Taylor, and you're listening to KZSB AM 1290. Okay, so as we come to a close, I just want to go back through with you just a bit about therapy. That therapy is not easy, but trust me that if you continue to learn about yourself, you will begin to be able to shift in both subtle and very dramatic ways. And that those who do take the time to work in the therapy with their therapist, that they often find relief from some of their own emotional distress, and they begin to lead more productive and fulfilling lives. Really, the first relationship needs to be with yourself. You need to understand who you are and then who you are with others. So again, here are some of the reasons why you actually might consider entering into therapy. If you're feeling sadness or grief or anxiety that is just persistent, then therapy can help to not only relieve those symptoms, but to discover the underlying causes about why you are in that kind of emotional distress. Or if you're not reaching your goals and you're really feeling stuck, therapy is a great place to go to really reveal the obstacles that keep getting in your way. And therefore, it allows you to get back on track quicker, because that's the goal, is to get out there and live your life and do what you were meant to do and stop living behind your fear. One of the other reasons is that if you're having difficulty in a relationship, therapy can be of value to really improve communication skills, coping skills, and to really understand what the underlying dynamics that are going on between the two of you. And then, of course, if you're dealing with any kind of loss or death of a loved one, it is a great place to go to just be able to process and to really work through all the stages of grief. For those of you who have had any kind of trauma, any kind of abuse, or any kind of violence, therapy is a good way to help you to deal with the issues of being a victim, and then how to really regain and to empower yourself so that you can move from being a victim into taking back your life. Also, often people come in because they're having sexual problems, but they feel too embarrassed. But really, a trained therapist can really help you to understand and to overcome whatever's going on that is really impairing your sexual functioning. So the truth is I think that we can all benefit from therapy at various points in our life. To really be able to see it as something that you can do to prevent other things from going on, or maybe just a routine form of taking care of yourself to keep you balanced. What we find with the research is really the best type of therapy always reaches the same conclusion, that it's much less important the type of therapy as it is the relationship between you and your therapist. So if it's a place that you feel comfortable with, a person that you feel that you can trust, and if you have a therapist who will challenge you, then you will be able to do the work and then move ahead into a more fulfilling life. There's a quote by Maya Angelou that I always like, and it's, "When we know better, we just do better." And think about it. If we were all doing better, the world would just be a better place. So let's make this a place every Thursday afternoon between 2 and 3 where we can meet and we can work on the issues in your life. I am going to be here, so I hope that you will be here too. To just think about it as a place that you can come for ask for help so that you can reach your goals and that you can really have the life that you want. And until then, I also want to put out there that if you have any topics that you would like covered, if you want to tell me how you think the show is going, just send me an email. I welcome all of your comments and all of your questions. You can email me at drkim@drkimtaylorshow.com. And I also want to go through this, that there are now a lot of ways that you can tune in and participate here on the Dr. Kim Taylor Show. Of course, you can listen here at KZSB AM 1290 every Thursday afternoon from 2 to 3. Or now you can listen to the program live on the internet or even on your smartphone. All that you have to do is just go to my website and click on the icon. So the website's drkimtaylorshow.com, and it's as easy as that. If you want to listen to any past shows, you can now find them posted on my website, or you can download them for free as a podcast on iTunes. Also, if you subscribe through iTunes, you will then automatically be sent the podcasts as they become available. So really, check it out. There's no excuse now for not tuning in. One more note. These shows can also be heard again with the rebroadcasts that are Thursday evenings at 10 and Sundays at noon, right here at KZSB. And here is a note that I want you all to know is that Sundays I am going to be taking phone calls, and I'm going to try to answer all of your questions. And you can check out on my website how to contact me on that day, what the times are, and what the phone number is. So again, just go to drkimtaylorshow.com, and let's talk then. As we close, I want to make sure to thank Richard here for helping me out today, and I want to just put a shout out there to Sandy Jacoy, who could not be here but is with her dad, and I wish them the best. Let's keep this Thursday date going on. Write it in your calendar. Tell your friends. And then give me a call. I am really here to help, and I will be here every Thursday. So meanwhile, have a great week, and until then, be good to yourself. And remember,